Common cold. The common cold or the cold is a viral infectious disease of the upper respiratory tract that primarily affects the respiratory mucosa of the nose, throat, sinuses, and larynx. Signs and symptoms may appear fewer than 2 days after exposure to the virus. These may include coughing, sore throat, runny nose, sneezing, headache, and fever. People usually recover in 7 to 10 days, but some symptoms may last up to 3 weeks. Occasionally, those with other health problems may develop pneumonia. Viruses are usually transmitted from person to person through actions such as handshakes and conversations. Resting, consuming plenty of water, eating fruits rich in vitamin C such as lemons and oranges will help you recover. Diabetes. Diabetes or diabetes mellitus is a metabolic disorder, usually caused by a combination of hereditary and environmental factors, resulting in excessively high levels of glucose in the blood. Symptoms of diabetes include profuse and frequent urination, thirst and increased appetite. Diabetes is a chronic disease for which there is no definitive cure, and medical attention should be given to diabetes-related problems that may arise both in the long term and in the short term. Influenza. Although the flu passes in healthy people in an average of a week, it can lead to fatal diseases such as pneumonia, meningoencephalitis, and myocarditis in people with chronic diseases that reduce body resistance and in the elderly. People in such risk groups are called high-risk groups. The virus is transmitted by droplets spread by coughing and sneezing, but also through contact such as kissing and shaking hands. Antibiotics are useless because antibiotics only work on bacteria. The illness will get better on its own in about a week, but it is necessary to see a doctor and rest well for 3 to 5 days. Drinking plenty of fluids also speeds up recovery, as it allows secretions to be easily expelled. Bronchitis. Bronchitis is inflammation of the bronchi in the lungs that causes coughing. Bronchitis usually begins as an infection in the nose, ears, throat, or sinuses. The infection then makes its way down to the bronchi. Symptoms include coughing up sputum, wheezing, shortness of breath, and chest pain. Bronchitis can be acute or chronic. Decline in lung function in chronic bronchitis may be slowed by stopping smoking. Chronic bronchitis may be treated with a number of medications and occasionally oxygen therapy. Chlamydia. Chlamydia, or more specifically a chlamydia infection, is a sexually transmitted infection caused by the bacterium Chlamydia trachomatis. Most people who are infected have no symptoms. Symptoms in women may include vaginal discharge or burning with urination. Symptoms in men may include discharge from the penis, burning with urination, or pain and swelling of one or both testicles. Prevention is by not having sex, the use of condoms, or having sex with only one other person who is not infected. Chlamydia infection can be effectively cured with antibiotics. Guidelines recommend azithromycin, doxycycline, erythromycin, levofloxacin or ofloxacin. Mononucleosis. Infectious mononucleosis, also known as glandular fever, is an infection usually caused by the Epstein-Barr virus. Most people contract the virus during childhood, when the disease has few or no symptoms. In young adults, the disease usually results in fever, sore throat, enlarged lymph nodes in the neck, and fatigue. Most people recover in 2 to 4 weeks, but fatigue can last for months. The liver or spleen can also swell, and in less than 1% of cases a ruptured spleen can occur. It is spread primarily through saliva, but rarely through semen or blood. It can be spread through objects such as glasses or toothbrushes, or through coughing or sneezing. Only symptomatic or supportive treatments are used for this disease. Urinary tract infection. A urinary tract infection is an infection that affects a part of the urinary tract. Lower urinary tract infections may involve the bladder or urethra, while upper urinary tract infections affect the kidney. Symptoms from a lower urinary tract infection include suprapubic pain, painful urination, urge to urinate even though the bladder is empty, and urge to catch up with urine. Symptoms of a kidney infection include fever or flank pain. Rarely, urine may appear bloody. Wet environments such as pools, seas, saunas, not paying attention to genital hygiene, sexual intercourse, frequent partner changes, cause urinary tract infections. The main treatment is antibiotics. Cancer. Cancer is a group of diseases involving abnormal cell growth with the potential to invade or spread to other parts of the body. Possible signs and symptoms include a lump, abnormal bleeding, prolonged cough, unexplained weight loss, and a change in bowel movements. Over 100 types of cancers affect humans. Commonly known cancer treatments are done in 5 different ways. Surgery, removing the cancerous tissue and some surrounding healthy tissue at risk of invasion. Radiotherapy, killing cancer cells by applying appropriate doses of radiation. Chemotherapy, using drugs to kill cancer cells. Immunotherapy, the effective use of immune system cells against cancer. Stem cell transplantation, its application for people with blood-related cancers such as leukemia or lymphoma. Chickenpox. Chickenpox is an infectious disease caused by the varicella zoster virus. Chickenpox symptoms first appear on the trunk and face. The disease is mostly seen in children. It is a highly contagious viral infectious disease with fever and rash, most commonly seen in 5 to 10 years old, in late winter and spring. It is transmitted through direct contact or airborne secretions of infected people. The rash starts as red bumps. These rashes cause itching. In recent years, the disease has become less common with the gradual increase in vaccination. Treatment includes lowering the fever with antipyretics prescribed by your doctor and preventing itching with oral or skin medications. Aspirin should never be used during this period, as this can lead to Ray's syndrome, a serious hepatic coma. Taking a shower with a mixture prepared by mixing a tablespoon of bicarbonate of soda in a bucket of warm water can also be relaxing. Gastroenteritis. Gastroenteritis, also known as infectious diarrhea or simply as gastro, is an inflammation of the gastrointestinal tract including the stomach and intestine. Symptoms may include diarrhea, vomiting, and abdominal pain. Fever, lack of energy, and dehydration may also occur. Gastroenteritis is usually caused by viruses. However, gut bacteria, parasites, and fungi can also cause gastroenteritis. In children, rotavirus is the most common cause of severe disease. In adults, norovirus and Campylobacter are common causes. Eating improperly prepared food, drinking contaminated water, or close contact with a person who is infected can spread the disease. Gastroenteritis is usually an acute and self-limiting disease that does not require medication. Cardiovascular disease. Cardiovascular disease is any disease involving the heart or blood vessels. Cardiovascular diseases constitute a class of diseases that includes coronary artery diseases, heart failure, hypertensive heart disease, rheumatic heart disease, cardiomyopathy, arrhythmia, congenital heart disease, carditis, aortic aneurysms, peripheral artery disease, thromboembolic disease, and venous thrombosis. This disease can be caused by other factors such as high blood pressure, smoking, diabetes, lack of exercise, obesity, high blood cholesterol, poor diet, excessive alcohol consumption, and poor sleep. High blood pressure is estimated to account for approximately 13% of cardiovascular disease deaths, while tobacco accounts for 9%, diabetes 6%, lack of exercise 6%, and obesity 5%. Up to 90% of cardiovascular disease may be preventable if established risk factors are avoided. Currently practiced measures to prevent cardiovascular disease include diet, lose weight, not drinking alcohol, not smoking, exercise, lowering blood pressure, reduce stress, getting enough sleep. Hepatitis. Hepatitis is inflammation of the liver tissue. Some people or animals with hepatitis have no symptoms, whereas others develop yellow discoloration of the skin and whites of the eyes, poor appetite, vomiting, tiredness, abdominal pain, and diarrhea. Hepatitis is acute if it resolves within 6 months, and chronic if it lasts longer than 6 months. Acute hepatitis can resolve on its own, progress to chronic hepatitis, or result in acute liver failure. Hepatitis is most commonly caused by the virus hepatovirus of B, C, D, and the hepatitis B virus is the most common, transmitted from person to person blood products and infected body fluids. Short workouts, high-calorie diet, medicines will help you recover.